Hello and welcome. My name is Maren Gutters, and today we're going to be talking about the urgent need for affordable health care and how we can reform our system through proven international models. First, we have a broken system. Imagine having to choose between life-saving treatment or your home. Millions of Americans face this every day. U.S. healthcare is the most expensive in the developed world. Why is that? 30 million of Americans remain uninsured. These are the reasons for being uninsured. 63.2% are coverage not affordable. 27% not eligible for coverage. 26.6% do not need or want. 23.9% deciding it was too difficult or confusing. 18.9% cannot find a plan that meets needs, and 4.7% have lost their jobs. This is why reform is urgent. The U.S. system is costly, inefficient, and leaves many behind. Other nations achieve better outcomes at lower cost. Reform is both an ethical and economic necessity. These are the main points I will be talking about in my presentation today. U.S. healthcare costs versus other nations, global models that work, a need for drug prices negotiation and cost controls, and actionable solutions for reform. As you can see by the chart here, USA has the most expensive healthcare in the world. And then it's Germany, Sweden, Canada, UK, Italy, South Korea, and finally Poland. Start quote. National healthcare spending in the United States amounted to $4.464 trillion in 2022 and was mostly funded by federal health programs and private health insurance. Although more than 10% of national healthcare spending in 2022 was attributable to out-of-pocket expenses for copays, deductibles, and services not covered by insurance. End quote. Dr. Rebecca Murray Watson on June 28, 2024. America is an expensive and efficient system. 17.3% of GDP spent on healthcare. Admin costs equals 25% of spending. Poorer outcomes, lower life expectancy, higher in fact mortality. And this is the universal health care. Canada equals a 10.8% of GDP universal coverage. Germany, employer/employee shared insurance. UK has NHS funded through taxes, no out-of-pocket cost. And what is the common theme of all this? Healthcare is a human right, not a privilege. Drug prices and cost controls and why Americans pay more. U.S. drug prices 2.78 times higher than OECD average. Brand name drugs are 4.22 times higher. No national negotiation, which equals sky high cost. Other countries negotiate, so why shouldn't we? And this picture shows the U.S. drug prices sky high in international comparison. Expanding access through Medicare and public opinion. We should lower the Medicare age to 60, 55, or all adults. Voluntary medicine buy-in option. Introduce a public opinion via ACA marketplaces. Build on existing systems equals politically feasible. Start quote. As of April 2021, 12 states have not adopted the Affordable Care Act, provision to expand Medicaid to adults with incomes through 138% of poverty. In these states, 2.2 million uninsured people with incomes under poverty fall in the coverage gap and do not qualify for either Medicaid or premium subsidies in the ACA marketplace. End quote. KFF 2021. This is the reform strategy. We just need to simplify administration. Standardized billing and HER systems can reduce race. easier for providers and patients alike, and more times on care, less than on paperwork. Preventative care is also a great reform strategy. Prevention reduces long-term costs, 90% of spending tied to chronic and mental health. Early detection, routine screening saves lives and money. Better outcome equals better lives and stronger economy. It is time to act. The US must stop treating healthcare as a luxury. We can learn from global models and improve lives. Urge policymakers to prioritize comprehensive reform. Make healthcare a basic human right. These are a bunch of quotes that I have from different sources about the healthcare costs that I found very intriguing. About 1 in 5 adults say they have not filled a prescription because of the cost, while some will say they have instead opted over-the-counter alternatives. 1 in 4 adults say in the past 12 months they have skipped or postponed getting healthcare they needed because of the cost. About half of uninsured adults worry about affording their monthly health insurance premium, and large shares of adults with employee-sponsored insurance. About 4 in 10 adults report having debt due to medical or dental bills, including debts owed to credit cards, collection agency, family and friends, banks, and other lenders to pay for their healthcare costs. About half of the U.S. adults say that it is very or somewhat difficult for them to afford their healthcare costs. Among those under age 65, uninsured adults are much more likely to say that affording healthcare costs is difficult compared to those with health insurance coverage. Additionally, at least 6 in 10 Black adults and Hispanic adults report difficulty affording healthcare costs compared to about 4 in 10 white adults. Adults in households with annual incomes under $40,000 are more than 3 times as lucky as adults in households with incomes over $90,000. To say it is difficult to afford their healthcare cost is an understatement. And that is all. Thank you so much for joining me. And if you have any questions at all, I'll be glad to answer. Thank you.